We still have 400 new infections each day in South Africa. And that is a lot less than we had 20 years ago when it was about three times as much. The main reason why those infections have gone down is because we have rolled out antiretroviral treatment. Because that treatment doesn't just keep people healthy, it reduces the amount of virus in someone's body to such a low amount that they can't infect other people. Now, research shows us that the way to deal with HIV now, to bring the pandemic to an end, is to focus on groups that have a higher chance than the general population to get HIV. And one of those groups are migrants. Just as you saw in your previous interviews, they don't have stable places to live in, they have stressful lives, and that often leads to environments where they need to make choices that they wouldn't have made otherwise. So migrants are specifically a group to focus on. So to prevent them from accessing treatment means that you don't test them, you don't put them on treatment, and you don't prevent the spread of HIV. Now, when people have sexual relations, they don't stick to citizenships. So in a country, it doesn't make scientific sense to do that.
Yeah, and that was exactly my next point to you, is that we have, illegal immigrants or those foreign nationals who are undocumented, and they are in relationships, like you say, they are in sexual relationships with South Africans. That is a reality. There are children that are born out of these relationships as well. So what do we do? I mean, it obviously sounds to me like it's time to rethink the legalities around these treatment issues, because we know the NHI Act says they're only entitled to emergency care. They can't get free HIV treatment.
So that NHI Act has, of course, not been promulgated, so it hasn't yet been rolled out. But the law at the moment says is that those people should have access to primary healthcare services for free. But if we look at the future, the NHI Act says that when it comes to undocumented migrants and asylum seekers, they can only get free access to health services if it is a notifiable disease or an emergency. Now, a notifiable disease is a disease like TB that spreads, that's a serious disease, and it spreads very quickly. And because the government wants to keep track of who has TB where and who's getting treated, a notifiable disease means that if you get diagnosed, your name gets sent to government, some of your details get sent to government.